Candy? No. No means no.
Hi everyone, welcome back to my channel. If you're new here, I'm Anna. I am a doctoral intern of clinical psychology. This is Countess Chianti. She will probably be walking around today. Today we're talking about TikTok's ADHD misinformation problem. This is something that has been on my mind for a long time, honestly, and I was a little nervous to talk about it because I know a lot of people identify really strongly with that faction of TikTok. But after so many clients coming to me saying, I think I might have ADHD because of something I saw on TikTok, because of even family members I know telling me that they have ADHD because of what they saw on TikTok, I decided enough is enough. We have to talk about this. So today we're going to talk about what ADHD actually is using the good old trusted DSM-5, the diagnostic manual that actually determines whether someone meets criteria for a certain disorder. We're also going to talk about why this TikTok problem exists, why it's so appealing to people to want to identify with the label of having ADHD. We're also going to look at a few examples. I'm going to try my best to be understanding of the people who are posting that kind of stuff, because I know it often doesn't come from a bad place, but I do think it's really important to name it for what it is, which is misinformation and potentially dangerous. All right, let's get into it. So ADHD, or attention deficit and or hyperactivity disorder, is a neurodevelopmental disorder, which means it develops early on in childhood. It is a very neurological developmental type of disorder. So it is not possible to develop ADHD later in adulthood. You can certainly develop an attention deficit issue caused by something like a traumatic brain injury. You can have amnesia as the result of something like trauma. That is not ADHD. ADHD is something very organic that emerges within childhood. That's not to say that people can't be undiagnosed, especially women are known for masking neurodivergence, and so it is very possible that someone could go through childhood without being diagnosed because they've been socialized to behave in a way that's still socially acceptable, and then get to adulthood and find out that they have some ADHD symptoms and maybe even get diagnosed. But that is neither here nor there. So cute. I'm just gonna tilt this so you can see her more fully. Okay. Let's go through the diagnostic criteria. So, in order to be diagnosed with ADHD, you have to have a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development, as characterized by either number 1, inattention, which includes 6 of the following symptoms that we're going to go through, and or number 2, which includes hyperactivity and impulsivity, which also includes 6 or more of the following symptoms that we're going to go through, plus some other criteria that we will get to in a moment. So it's pretty common for children to have ADHD, meaning they do have some of that impulsivity, hyperactivity, difficulty sitting in their seat, kind of going all over the place, climbing on trees, stuff like that. And then usually when people get to adulthood, they tend to lose that part of hyperactivity and stay more in the attention deficit part, also called ADD. So in order for the criteria to be met for inattention, you need 6 or more of the following symptoms that persist for at least 6 months in a way that is inconsistent with developmental level and negatively impacts directly social and academic or occupational activities. So it can't just be like, oh, I relate to this a little bit, I relate to that a little bit. No, it has to actually impair your functioning. It has to be significant enough that this is something that is causing disruptions in your ability to move through the world. So the symptoms are: often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities, often has difficulty sustaining attention in tasks or play activities, often does not seem to listen when spoken to directly, often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace, often has difficulty organizing tasks and activities, often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, often loses things necessary for tasks or activities, is often easily distracted by extraneous stimuli, is often forgetful in daily activities. So again, I want to emphasize, if you relate to some of these go get tested, go get an evaluation, go speak to a therapist. You cannot self-diagnose, and we'll get to that in a second a little bit deeper, but with something like ADHD, it is really extremely important that you not self-diagnose because it could be something completely different. So those were the symptoms for inattentiveness. Now moving on to hyperactivity and impulsivity. So same thing, you need 6 or more of the following symptoms for at least 6 months to a degree that is inconsistent with developmental level and negatively impacts directly your social and academic or occupational activities. So, often fidgets or squirms, often leaves seat in situations where remaining seated is expected, often runs about or climbs in situations where it is inappropriate, often unable to play or engage in leisure activities quietly, is often on the go, acting as if driven by a motor, often talks excessively, often blurts out an answer before a question has been completed, often has difficulty waiting for his or her turn, and often interrupts or intrudes on others. Those are the symptoms for hyperactivity, impulsivity. So several of these inattentive or hyperactive impulsive symptoms must be present prior to age 12. So it can't be that suddenly you think you have ADHD symptoms. It has to have started before age 12. These symptoms have to be present in 2 or more settings. So at home, at school, at work, with friends, with relatives, and other activities. It can't just be specific to one situation where, say, you experienced a trauma or someone makes you uncomfortable. It has to be kind of global to a whole host of situations. There has to be clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So it has to be severe enough that it is impairing your functioning. Now, is it possible to have sub-threshold, subclinical attention deficit issues? Of course, but you cannot say that you have ADHD if you are below a certain threshold. That's not to say that your symptoms don't matter, that they're not important or distressing. Of course they are, but we need some sort of mechanism for categorizing these things to know what we're talking about. Are we talking about clinical ADHD, or are we talking about some inattentiveness and impulsivity, hyperactivity issues? The symptoms also cannot be caused by schizophrenia, another psychotic disorder, or another mental disorder, such as a mood disorder, anxiety disorder, dissociative disorder, personality disorder, or substance intoxication or withdrawal. So those are the really bare bones criteria. There's obviously a lot more that we could go into what exactly ADHD is, but I want to get that really, really clear so that we have some understanding of what it is we're talking about when we mention ADHD. The issue is that sometimes people with sub-threshold symptoms of attention issues could be pathologizing something that is actually just a normal human experience. It's very appealing for people to want to put a label on something, to say, oh, this explains it, now I understand, now there's a reason why I am the way I am, this validates me, this helps explain my behavior. Of course, that feels good to people. And unfortunately, I know some of you might get upset with me for saying this, but I do think some people use undiagnosed ADHD labels as a way to excuse behavior. Now, people with ADHD, people with neurodivergence have reasons why they behave the way that they do. The brain just works a little bit differently, and that is okay, and we can be compassionate for that and try to help them out in whatever way we can. But there are some people who say they have these things and don't, and sort of weaponize their incompetence in order to get certain rewards or to get out of certain responsibilities. It's very dangerous to attribute a normal human experience to a diagnosis, because this can lead to people erroneously self-diagnosing with ADHD, something that could in all likelihood be something else, or just, like I said, a normal human experience, something that we all experience. We all at times forget things, misplace things, procrastinate, have difficulty concentrating on something. And if it is the case that it's not ADHD, either it's something else or actually it's nothing at all, then there are great dangers to misdiagnosing ADHD, because with ADHD, of course, come stimulant medications, which, as we know, can be extremely harmful and addictive for people who don't have ADHD. And I've worked with people who have ADHD who also want to stay away from them just because of the nature of these medications, especially for people that don't need them to be on stimulants, amphetamines. That's bound to cause some issues with your brain. I mean, it causes issues for people who need those medications as well. Things like not eating, not sleeping, mood disturbances, anxiety. You can imagine how much worse the consequences are for someone that actually does not have the disorder those medications are created for. And you might say, well, how does someone get on those medications if they're undiagnosed? The truth of the matter is that a lot of people are misdiagnosed with ADHD. That's a real problem. And a lot of people go under the table. You know, especially in colleges, I've seen so many people use stimulants despite not having a diagnosis. It is not that hard to procure stimulants. So mismedication or self-mismedication is a danger. Over-identification is a danger because if you identify with a label that first of all is not accurate for you and you're also using it to excuse your behavior, that can cause a self-fulfilling prophecy, that can cause weaponized incompetence. It's pathologizing of something that is an experience we all go through. And it's misinformation because as we'll see in some of these TikToks, the things they're saying are not accurate depictions of what ADHD is. Categories are interesting because they're very arbitrary. All the time, we're sort of adjusting categories to more accurately depict the construct that we're talking about. So ADHD is a scientific label for a set of very specific symptoms that we went through that have all been shown to cluster around one consistent construct known as ADHD. And within that, there's obviously a ton of within group variation because there are a lot of symptoms, as you saw. So one person's presentation of ADHD can be wildly different from another person's presentation. And as we know, things like demographics, socialization, gender play a huge role in how ADHD is going to appear to people. So one person saying, this is what ADHD is like for me, might not be as accurate as what the actual symptoms are. That could be perfectly accurate for their personal subjective experience, but it's not necessarily quite what ADHD is. It's what their presentation of ADHD looks like. But it's really important for us to keep in mind these constructs because think about it. I could be trying to explain to you what a telephone is. So I could say a telephone is a device that is used to call other people through, I don't know, what is it, radio waves? I don't know how I actually don't know how telephones work. Satellites, whatever. And you're able to reach someone in a different part of the world and communicate to each other that way. That's like a very threadbare description of what a telephone is. Feel free to correct me if you have a better definition. Versus if I say, look at this telephone. This telephone sitting right here is black, it's shiny, it is rectangular, it has buttons. If I describe a telephone to you that way, I'm leaving a lot up for interpretation. I'm setting you up to be very confused because the next time you come across a laptop or a smartphone or a typewriter, maybe even a piano, you might look at that and say, oh, is that a telephone? No, because I described certain attributes of the telephone that are true. It's true of my telephone. This is what my telephone looks like. This is how it functions. But it's not the accurate description of what a telephone is. And it's exactly the same with people describing their experiences of ADHD, is that inevitably the people watching that ask themselves, do I relate to this? And does this mean that I could have ADHD? And when they're saying not the core definition of what ADHD is, but rather their personal experience of a few traits or descriptors of how their ADHD looks, then that can confuse the other person to think that that's what ADHD is, when in reality, that is just one presentation and it doesn't clearly distinguish between that and other constructs. It's really important for scientific reliability and validity to have a scientific consensus on what it is we're actually talking about. Now, you can absolutely study people's subjective experiences, their lived experience of a certain disorder. So you can do a study, for instance, that looks at 6 participants and their experiences with ADHD and say, here are the 8 themes that define the lived experience of people with ADHD. But even then, even if it takes scientific steps to make sure that it's valid and reliable, it still does not have external validity because it's subjective. Qualitative research, I love qualitative research. My dissertation is qualitative, but I don't pretend that it applies to everyone. I don't pretend it's applicable to the entire population I'm studying, only to the sample of people I'm studying. And when you put something out on the internet and say, this is my experience of ADHD, inevitably people are going to watch that and relate to it, and then they're going to be confused about what ADHD is. And one more thing before we watch some of these videos that I think are problematic, I think it's important to understand why a professional has to diagnose ADHD. This isn't some elitist bullshit about if you don't know, we're so much smarter than you, like blah, blah, blah. This is about the fact that ADHD is actually a very difficult disorder to make sense of. It can look like a lot of different things. It can look like bipolar disorder. It can look like anxiety. It can look like autism spectrum disorder. It can look like obsessive compulsive disorder. In fact, I have had clients who had ADHD or their family members had ADHD and they or their family members had all these other disorders because they're very closely linked. Clearly, there are some genetic predisposition to all of these things that cause a similar presentation. In psychology, we call this a differential diagnosis, something that we need to rule out before determining that this is really ADHD. And also, I think there's a difference between a therapist or a mental health professional noticing certain patterns in their clinical work, saying, here are the things I've observed among people with ADHD that I've treated, versus one lay person using a sample size of 1 to attribute a bunch of behaviors to their diagnosis, even when some of those behaviors might have nothing to do with their diagnosis. They could be completely unrelated. So now let's react to these videos. So the way that I found them was I just looked up ADHD on TikTok, and these were on like the first page that I saw. So it's going to be a lot of misinformation that is readily available for people to look at. All right, so things I didn't realize were ADHD until getting diagnosed. Again, I just want to say, no hate to these people. Definitely don't send any hate their way. I think their intentions are pure. They just want to share their lived experience with other people. I also want to be mindful about the way this could cause misinformation and confusion about what ADHD is, because unfortunately, I think as a therapist, I see it all the time. Taking things too personally. Taking things too personally is most definitely not a symptom of ADHD. Now, rejection sensitivity is something associated with ADHD. It can be associated with it, but it is not a core symptom. And in fact, it can be caused by a lot of things. It can be caused by past traumas, relational issues, personality disorders, anxiety. It can be caused by so many things. And so if you relate to this, do not assume that it is ADHD. Frequently oversharing, again, it could be caused by anxiety. It could be caused by extreme extroversion, wanting to please other people, by wanting to connect with other people. Not necessarily caused by ADHD. Dissociating or daydreaming. Dissociation is very broad. I don't like when people put daydreaming in the same category as dissociation without specifying that it's a very, very low level form of dissociation, because dissociation can look like something like an out-of-body experience. Depersonalization, where you don't feel like you're yourself. Derealization, where the world around you doesn't feel real, or it feels strange, or like you've never seen it before. It can be dissociative identity disorder, where you have multiple personalities. Dissociation can come from a lot of different things, mostly caused by trauma and anxiety. So to say that dissociation is clearly caused by ADHD could be true for her, but is most definitely not necessarily true for everyone else. Hearing what people say but not processing it. Again, this can be caused by anxiety. This can be caused by dissociation, which could be caused by anxiety or trauma. This can be caused by a traumatic brain injury, a concussion, a processing issue, not necessarily ADHD. I feel like I sound like a broken record. But as you can see, all the different things that I listed, you could be a person with anxiety or a person with trauma, for instance, see this and think, oh my God, maybe I have ADHD. And like I mentioned, that can cause a whole lot of problems if you convince yourself that you have ADHD and you don't actually get properly diagnosed with what is the actual label for what you have, or lack of label, because it could be nothing as well. Okay, low self-esteem, again, definitely not a symptom of ADHD. It could be something that is caused by feeling like you're always behind because of your ADHD symptoms, but low self-esteem is really its own construct. It can most certainly be caused by things like trauma, social anxiety, personality disorders, mood disorders. Struggling to stay organized and then being overwhelmed with the mess, I would say that actually does sound more consistent with ADHD. Obviously, the closer these TikToks are to the core symptoms of this disorder, the more accurate they are, and the more they veer, the more problems they can cause. Being done by the end of the day due to being overstimulated. Yeah, again, I would say this is pretty common for people with ADHD, and it can also be caused by things like mania, anxiety, overworking yourself, burnout, not taking breaks, and so forth. Feeling lazy, feeling like a bad spouse or parent, feeling adult-ish. This is another thing where, of course, it can be caused by this disorder, but it is also something incredibly common that I would say almost everyone feels. Almost everyone jokes about adulting and how they don't identify with that, and how sometimes they feel lazy, unproductive, sometimes they feel like a bad partner, a bad parent. I think this is almost a universal experience and not something that we should confuse people could be ADHD. Constantly playing catch up and feeling like your life is a hot mess. Yeah, again, that is a little bit closer to the actual symptoms of ADHD, but I feel like I sound like a broken record. It could be other things as well. Getting overwhelmed at stores because of sounds and distractions. Okay, this is really important because it's along the lines of my point about how is a symptom of ADHD can also be a symptom of autism spectrum disorder. It can be a symptom of an anxiety disorder. It can be a symptom of a sensory processing issue. And so it's really, really important if people relate to this to be able to get clarification on what exactly it is that's causing this symptom. Avoiding people and new friendships because it's impossible to keep up with responding. Again, this could be social anxiety. This could be a very normal experience that almost everyone relates to. There's no harm in getting assessed. Good. I like that because this shows don't self-diagnose yourself. She's saying this is what it could look like. Maybe this is what it looks like for me. If you relate to this, it can't hurt to get assessed, get evaluated. And I realize as I'm saying this that is complicated because getting psychological evaluations can be extremely costly, time-consuming, difficult to get on a wait list, and so it's most definitely a privilege to be able to get a diagnosis. It is really important. It's really important to get clarification on what you're actually working with so that you can understand what the treatment is. Things I do that I didn't realize were symptoms of undiagnosed ADHD. The undiagnosed piece bothers me. I think what she's saying is these were the symptoms that I had that I didn't realize were ADHD until I was diagnosed. But a lot of people are going to see this and go, oh, I'm undiagnosed with ADHD. I don't have a diagnosis of ADHD. And if I relate to these symptoms, maybe I have ADHD. Maybe I don't even need that diagnosis because I have undiagnosed ADHD. Rewatching TV shows a lot. Come on, man. We all do that. We all do that. Maybe there is somewhere a study that says people with ADHD rewatch TV shows a bit more than other people, but I really doubt it. I really, really doubt it. Craving sweet things. I have nothing to say except that this is incorrect. This is a normal human experience that almost everyone has. It's not even a disorder. Easily distracted, bored quickly. Okay, yes, that can be a symptom of ADHD. Poor time management or time blind, that can be a symptom of ADHD. Feeling overwhelmed at supermarkets. Overstimulation. Overstimulation, again, can be ADHD. It can be other things. Really important to rule those out. And it's not specific to supermarkets, you know? No patience, again, could be ADHD, could be other things as well. Constant fatigue / burnout. I mean, it's true that for people who have this disorder, doing simple things, like things that are simple for non-neurodivergent people, is a lot harder. It takes a lot more energy. But this can also be caused by depression, obsessive compulsive personality disorder, just being burnt out, just being in a very capitalistic, individualistic job or workplace. So I'm not gonna say it again. I'm not gonna say that this can be caused by something else. It can be attributed by something else. I'm just gonna leave you with this. I think a lot of people posting these videos are well-intentioned. And they want to share their lived experience with other people, and they want other people who maybe didn't consider that they could have this disorder to learn that about themselves and to get treatment and evaluation and so forth. That's great. We as consumers have a responsibility to acknowledge when something is actually describing what a telephone is versus describing what a telephone can look like. I think this is the takeaway I want you all to leave with today. What they're putting out there is not necessarily false. It's most definitely true for some people who have a specific disorder. But if you relate to these symptoms, that doesn't mean you have ADHD, and this is a really complex disorder that you should let a professional figure out for you. And be aware that people have a monetary incentive to talk about things that are trending. Now, I'm not saying any of these people are faking it for internet clout, but I'm sure there are people out there who are. And the more misinformation we produce, the more confused people are about what ADHD is, the more likely it is for us to actually start seeing people who are undiagnosed saying this is what ADHD is, and they're attributing completely different signs that have nothing to do with ADHD. So just be mindful of the content you consume. Keep an open but critical mind when hearing these sorts of things. Please, if you suspect you have ADHD, seek professional treatment if you can. Thank you for listening to today's video. That was a lot. I hope it was helpful. Comment down below if it was. I'll see you soon.